dedicated to ensuring that food is healthy, affordable, sustainable, fair, and accessible for all Los Angeles residents. And a huge part of how we do that is through our Good Food for All agenda, which provides a map for building an equitable, sustainable, and resilient food system in LA. This agenda is informed by over almost 200 key stakeholder surveys, interviews, working groups, convenings, all throughout last fall, where we had nearly 200 partners contribute what they thought were the challenges and priorities for the next 10 years for us to all collectively achieve our mission. We have 3 pillars: economic development pillar, which was last week. Today, we are focusing on the food and nutrition security pillar. And then next week, we will talk about the environmental sustainability pillar. And what I'll give you guys an update on, just to make sure we're all starting on the same starting point, is some of the data in LA, and then also what the pillar actually says we should be focusing on. And then for the rest of the time, you'll hear from our wonderful partners, Arnali from the Hollywood Food Coalition, Nicole Steele from Social Justice Learning Institute, and Lena from Neighborhood Legal Services of LA County, who in their particular project, Bila Network. All of these orgs really focus on thinking about how we encourage nutritious and reliable meals and culturally appropriate meals, like Hollywood Food Coalition. How Social Justice Learning Institute really focuses on building community power through mobilization, education, and how do we use our legal services and public benefits to ensure that immigrants and some of our most vulnerable populations are able to navigate those systems. So you'll hear like how each of the 3 of these amazing orgs and ladies are working to move this work, because if they're successful, then we all ultimately are more successful. And that will be moderated by our lovely Director of Policy and Coalitions, Arnali later today. So if you have any questions, burning thoughts, you can definitely put them in the chat and we'll keep track of them. For now, I'm going to just kind of dive into just making sure we're all starting from the same starting point and understanding what the problem is and what we all think the solutions are. So food insecurity and nutrition insecurity in Los Angeles is a problem that we all know, and unfortunately, we see it rising with different federal changes with SNAP. About a quarter of households in LA face food insecurity, and a little bit less than that, 21% face nutrition insecurity. For those maybe unfamiliar with this distinction, it's as simple as like access to food versus access to nutritious food. Ultimately, we want everyone to be fed, and even better if they're fed with nutritious food. And so that's really where that distinction comes into play. Again, unfortunately, we see these numbers potentially rising as things that we know for a fact help to alleviate this, like SNAP, are coming under attack and folks are getting pushed off of those programs. We know another big part of what plays a role in food and nutrition security is food access, like the literal ability to purchase food in your community. We've seen that increase over the last decade or so in LA. We also know convenience stores, and through our program, like Healthy Markets LA, has really encouraged the convenience store market to also sell healthy and affordable produce and food to their communities. So we know access in terms of literal availability has potentially improved across the county. And even with that, we know having something available doesn't necessarily translate into someone purchasing and consuming. A huge part of that is affordability. You can have as much fruit and vegetables, but if it's priced out for you, it's not going to necessarily address your food and nutrition security issues. This is older data. About 81% of adults in LA feel around perceptions of fruit and veggie affordability. Again, given the way the last 2 years have gone, we can kind of make some assumptions and inferences about where this number is changing. But again, access and affordability play a huge role in food and, in food and nutrition insecurity. And then the last piece I wanted to flag is also another proven method that we know works, and particularly when we talk about fresh produce, is through farmers markets and making sure that they're in multiple communities, in communities of different incomes and demographic backgrounds, and that has increased throughout the county and the city. And because of various policy efforts by many of the folks on this call today, the number of farmers markets who accept EBT is also increased, and majority of them do, and that number is continuing. And so there's a lot of efforts to kind of fill these gaps, both in terms of access and literal availability and affordability, to help improve food security as a whole, but also nutrition security in terms of consumption of fresh fruits and veggies. Just as a note and a flag, we are really focused on these priority populations. I'm not going to name every single one. Some orgs are focused on one of these, some orgs are combination, but between everyone, all the 60 plus people in this call, we are all touching some one of these populations to make sure. And so I just want to preface that as we get into what we've all just collectively through the Good Food for All agenda kind of decided is here's the solutions we want to be working on. Those are the populations that we want to make sure those solutions uplift. And so I'm going to pause there, continue to use the reactions. That is like where we started, and that is the work that we're working from. Moving forward, as you saw in this last slide, through all these different convenings, surveys, interviews, working group engagements, we talked about where we were and where we want to be by 2036. And so the food and nutrition security pillar really focuses on 6 different themes of recommendations and policies, programs, funding, and coordination efforts that need to happen over the next 10 years to be able to ensure all Angelenos have consistent access to healthy, culturally appropriate, and affordable food. And so I'm not going to go into every single recommendation. There are a number of them. I'm going to talk about each theme. And then I highly, highly encourage you all to actually read the agenda if you have not, and get more into depth. Again, we have 2 other themes, and there's a lot of work to be done. And again, if you're here today, you probably are already doing some of that work. And so the first one I want to talk about is boosting individual purchasing power through safety net programming. And this is in large part through improving and supporting enrollment with CalFresh, through integrated systems and multilingual outreach, and expanding funding for WIC, and then also the food security fund at the statewide level to ensure our public benefit staff are able to actually execute those things. It is important to note that, again, we have an economic development pillar, which is thinking about the flip side of this is how do we raise the standards for food workers and their jobs so workers themselves are not food insecure. But when and if you're without a job or underpaid, how do we ensure these safety net programs meet your needs as an Angeleno? Policy-wise, again, streamlining CalFresh enrollment. Another huge one, and I won't go into every single thing on this list, is we have so many proven data-backed programs like nutrition education, school meals, market match, and so many other items around like within improving enrollment and working with our college students and with our immigrant populations. These programs work. We know they work, and we simply need to expand, scale, and actually like fund them and streamline the eligibility and enrollment process. So there's a number of specific ones that are called out by our partners that we, again, know work, and if we're able to expand and scale them, we achieve our goal collectively. So again, I encourage you to read deeply about that. And then the next theme is around community design food security solutions. And so this is really talking about the fact that there are already communities who are seeing these gaps in their food securities in their areas and coming up with solutions. How do we support them and fund them? So thinking about mobile produce and meal vendors, good food retailer, which is kind of the basis of our Good Food Zone program with the city of LA, particularly thinking about partnerships and funding that supports the community-based orgs who are doing this work with unhoused, Indigenous, immigrant, and LGBTQ residents who are getting pushed out of some of the federal dollars. And then also working with our healthcare providers and college campuses to make sure that folks that they're focused on aren't slipping through the cracks. So as they're working with them on education and health needs, how are we making sure that their food security needs are met? And then the flip side of that is the policy funding and coordination to actually make those programs expand and happen. So some of these policy items are thinking about how to create a supply chain that is supportive of community design food security solutions, using things like the Good Food Purchasing Program, using things like state or local tax on sugar and sweet beverages to create funding for these types of programs. And then programs that maybe don't necessarily exist or have an existing funding source around delivery, grocery box programs, and supportive housing with working community kitchens, particularly thinking about how folks are able to continue to operate and overcome cooking barriers. And then the coordination that ultimately has to happen amongst those who work in the supply chain side to connect the dots to food security, and then also folks who work on the healthcare side and health system side to connect that to food and nutrition as important and make sure folks aren't slipping. So again, this is really thinking about community food security solutions that are already happening, supporting them, and then creating like systems, funding, and coordination to make that happen. The third item is charitable food system network building. So say you fall through the cracks of the safety net programming, say you fall through the cracks of some of these food security solutions, you are still able to go to food banks, pantries, and community orgs to receive food. How do we improve that coordination? LA County is a huge county with like 10 million folks. How do we improve coordination? And then also on our end, if folks are coming to us with food security and nutrition security needs, how are we making sure they're not slipping through the cracks of housing security and workforce development needs, and connecting the dots back to some of our other partners that I just mentioned need to connect the dots to us. And then the fourth theme is really thinking about our first food in ages 0 to 5. Again, when we're thinking about nutrition security, we know 0 to 5, the nutrition you get in those years plays a huge role in your like literal development as a person. And so really calling out the need to really uplift and focus on programs that supports our youngest Angelenos and making sure they're food and nutrition secure. And so some of this is just around coordination of that effort, providing funding for lactation consultants, ensuring that our child care providers are also able to access healthy food for their children in their care, and developing coordinated food delivery systems and lactation support for families with children ages 0 to 5 in high-need areas that are likely experiencing food and nutrition security. So this is really calling out the need we do need to really focus on our youngest Angelenos in particular in doing this work that can often get overlooked. And then our fifth and second to last areas around what we think about for nutrition education. So how do we ensure that our low-income residents actually know how to navigate all of the safety net programs that I just mentioned? That's a lot even for us. How do we create programs and support programs to support folks in navigating that? Nutrition education, public campaigns around the nutrition security, partnering with community-based orgs. I think, and when we think about some of the nutrition education that happens at orgs like SJLI and Hollywood Food Coalition, like a lot of this work is happening in public awareness around healthy food consumption broadly. So whether or not you're food insecure, are you actually also able to access and understand healthy food options for you in particular? And then the sixth item is often also where it overlaps very heavily with our economic development pillar, because again, access to food and through your retailers and options are a huge part of folks being able to be food secure. So thinking about policies and regulations to ensure that folks who are getting food from public venues or supported venues like housing and secure folks, the food that's going there is actually nutritious, similar to senior meals. The beverages and snacks that are available in vending machines on public properties are like banning unhealthy, but also means investing in healthy options at the same time. And thinking about policy guidance, thinking about grocery store development that keeps healthy food access in mind. And then on the programs and TA side, also goes back to how do we support those farmers markets, those grocery stores, and whatnot, and being able to provide fresh, healthy food to folks. At government side, thinking about this also as an income stream and getting more retailers on board with CalFresh, WIC, and Market Match, and creating public-private partnerships to fund neighborhood-based food programs. So again, this is where it overlaps heavily with the economic development pillar. So if this is something that interests you, I highly recommend you go back and read that section too. And so that's all my long-winded talk. You can see there's a bajillion things here, and it's going to require way more than LAFPC talking to you all about this. And that is why we have these 3 partner orgs. Again, there are certainly more than 3 doing this work, but they are the 3 that we're just going to highlight today because they kind of paint a picture of all 6 of those themes really well. LAFPC is committed to following up on this work. Our food systems analyst and Tasha is developing metrics to track everything and to see, like, are we actually achieving what we plan to achieve? And then just kind of echoing this work is collective impact. LAFPC is the collective impact org, which essentially means there's some work that LAFPC will champion and there's some work that we're cheerleaders for. And so today is really just like an example of that. I want to also, just before we get into it, just highlight ways. Again, you're going to learn a lot today, and you might be like, how can I get involved? We have some ways through LAFPC you can get involved. through our Food Recovery Alliance and other items. And then we'll also be dropping links as our panelists are talking about ways to get involved with their work. And if you have something to offer, please add it in the chat too. And so we'll click on that. And now I will pass it on over to our lovely panelists and our moderator, Arnali. I'm going to stop sharing so you all can see each other. There we go.
Awesome. Thank you, Deja, for that really wonderful overview and to help get us all on the same page around starting this conversation. I think you laid a really wonderful foundation for us to kind of kick things off. And just want to say a special thank you to our panelists who are all amazing leaders within our LA food system for joining us. I think you're going to be really just taking away a number of different strategies that are really comprehensive when you start to think about all of these ways that they address food and nutrition security from their own specific lenses. So, Lena, I'm going to kick things off with you. Thinking about last year, our nation's largest and most effective anti-poverty, anti-hunger program, SNAP, or Supplemental Nutrition Assistance Program, underwent some of its most historic changes in the program's history. So, through the passage of HR 1, we know that a number of folks are excluded from participating as eligibility changes to certain immigrant populations have gone into effect. We're anticipating changes around work requirements where folks who were previously exempt, who are seniors, who may be unhoused, who are disabled, or others, leaving maybe 300,000 people in LA County who may be ineligible for CalFresh benefits. So even before the current administration's exclusions and restrictions to SNAP, there were a number of strategies you were all already pursuing to improve access and eligibility for these programs. Can you share with us a bit about how your organization helps to navigate these important food benefits with people and any ongoing strategies to address these barriers?
Thank you, Annalicia, and thank you so much for inviting me. Really happy to be here to talk about this. So first, just super quickly, because there's a range of knowledge, I'm going to go over the top public benefits that are available that address food security. Because a really big aspect of public benefits advocacy is we don't have a contiguous safety net. We have to go to lots of different places and navigate lots of different systems to draw down all the benefits that folks are eligible for. So that's kind of the starting point. So we have WIC, which is a highly effective benefit for pregnant people and people parenting and their children up to age 5. That reduces child food insecurity by 20%. Like Annalicia said, we have CalFresh in California, which is SNAP federally. That's the single most important anti-hunger program. That's the place to start. And critically in California, we've always hovered between like 70 and 80% participation. So bold strategies to address the SNAP gap is something we all have to continue to work on. We've had lots of different strategies in LA. You'll hear in a second, I think a primary barrier is immigrant access to this benefit because of so many additional barriers, fears, and legal problems related to SNAP access. In LA alone, we have 943,000 households on SNAP, but that actually has gone down dramatically. It was 1 million cases just a year ago. We have Market Match, which I know you all work on very closely. Somebody here runs a Medi-Cal CalAIM medically tailored meals program, which is also very underutilized, but folks with a prescription can get food paid for through Medi-Cal, and people on Medi-Cal are pretty much categorically eligible for CalFresh. So strategies to really make sure that people dually enroll has been a long time process. School meals are free for everyone, and there's no barrier. You don't even have to fill out an application. So that's a really important place where people can continue to get food, even as immigration enforcement causes so much fear and reduces enrollment. And then we have Sunbucks, which is a new federal program that California opted into and like sends money to children during the summer. So that's our safety net for food. What does Neighborhood Legal Services do? You have, for most of these benefits, legal rights to these benefits. You have a right to appeal. Our organization, Legal Aid Foundation of Los Angeles, and a few other orgs, though not enough, provide full legal representation to people who are struggling with barriers to their benefits. These are complicated programs by design. Read the book, Administrative Burdens. That's how we structure our safety net. We want people to jump through lots of hoops because we really have to question whether we really want people to have these benefits, even though they're so effective and they boost the economy. And then through that process, we see hundreds of cases we're able to identify systemic barriers that people experience to these benefits. That might be just getting through a phone line, which I know for people who do any food advocacy, it can be very difficult to navigate our local welfare department, which is also, a funding issue, a support issue, a structural issue. But, after about doing that work for 5 years with the crisis in 2017 around a rule called public charge, which is an immigration rule, but it dictates who can get a green card as one of the grounds of inadmissibility through a family petition, which is how most people get green cards. That rule is tied to whether someone uses benefits and which benefits. And in 2017, when the rule was threatened to change, there was no consideration of the use of CalFresh, but that didn't really matter because public benefits, people kind of collapse and it always, into just if it's a public benefit, it's a public benefit. So people who are immigrants have always avoided CalFresh at a pretty high level. But it got much worse in 2017. So we looked for models around the state and we borrowed a model from San Mateo called Linking Immigrants to Benefits, Resources, and Education. And we started the Benefits Access for Immigrants Los Angeles network, where we can provide in-language enrollment through our network partners, comprehensive benefits assessment. So you don't have to do that hard work of what I just did, which is going over 5 or 6 different programs and how to enroll in them, and then the legal support to counsel people about the risks and benefits of using their benefits, which was kind of the piece that was missing. And then we do lots of outreach and technical assistance and trainings. So that is what we're doing, and but I'll close at the end with how it's getting much worse and more complicated with new barriers to benefits.
Thank you, Lena. Appreciate that. Now, Nicole, I'm going to transition to you. So SNAP also formerly had an education and outreach program called SNAP Ed, meant to address nutrition education and to support SNAP enrollment. That program, unfortunately, has been fully defunded under HR 1. Fortunately, we've been able to have some success in advocating for local funding, but it's very temporary. But the need for continued nutrition education and support is still strongly illustrated in the agenda. As a former SNAP-Ed funded partner, can you share how SJLI is approaching continuing to provide nutrition education and food access to your community?
Absolutely. I want to say the advocacy efforts that went into helping those of us that were funded through SNAP Ed into the Care First Community Investment pool was really inspiring to me. A lot of people on this call and not pictured on this call really came together like hard, like we were really hard in the paint, and helped to elevate the voices of our community in order to usher us into this kind of runway that we now have in order to continue this work at least for the next year. And so we actually intend to do just that. We want to really help to continue to educate people around not just the fact that these services are changing, have been threatened, but really what's happening around it so that they can understand the connections between what they're seeing in the news, what they're hearing, and what's happening in their actual communities, and then using their voice to help advocate for what they need. So we've really been leaning into teaching our community, teaching the people we serve about what's happening, letting them form their own opinions about it, of course, but just letting them know what's going on and then allowing them to share with us how this work impacts them, and then elevating that to our decision makers, to our grant makers, to anybody that is willing to listen and that could possibly fund this work. And then continuing to go hard in the paint, right? We know that this work is really important for people and not only just provides education and provides access to food, but it provides a place for folks to build community together. And when they're building community together, they end up empowering themselves and advocating for themselves. So there's been a lot of work into planning um, like programs similar to Food Leaders Lab on a smaller scale for our community. We want folks to be able to go out and teach each other and use the guidelines and the standards that we have as educators when we're in the community with their own neighbors. So that's been a lot of fun as of late, having folks come into our space, not just to receive food, but also to be learning about the current food landscape and how they can participate, and connecting them to things like the Good Food for All agenda so they know what's going on, can share that information, and can get themselves involved as well.
Thank you. Such important points. Arnali, I'm going to transition to you. So we have large federal policies that help raise the floor and improve food and nutrition security broadly, particularly for our unhoused and housing insecure communities. As instability there rises, charitable food networks will continue to work to meet increased demand for their nutritious and culturally appropriate foods and services. Can you speak a bit about the community exchange and how you balance continuing to be a leader in providing nutritious and culturally appropriate hot meals while also collaborating with charitable food networks in LA and within the LA Food Recovery Alliance?
Thank you so much, Anna Alicia. And it's great to be here today and to see so many familiar faces in the webinar itself. So again, my name is Arnali Ray. I'm the executive director here at Hollywood Food Coalition. We've been running a nightly meal service for decades. We've served high quality hot meals made from all rescued food. And so from the start, we've really prioritized freshness, nutrition, and cultural relevance, even when that takes more time and resources, because we believe that people deserve to have access to food that is culturally relevant, respecting their preferences. When the pandemic hit, we experienced an influx of donations. Obviously, a lot of businesses closed and they wanted to make sure that their food didn't get wasted. So we had more food than we can handle on our own. And so at the same time, we had a lot of partners who are reaching out to us saying, how do we start our own food program? And that's really essentially how our community exchange program began. For us, the word community exchange is moving away from this one-way model of service. It's actually something that's more reciprocal and relationship driven. We stay in close communication with our partners and actively ask for feedback so that we're making sure to source food that people actually want and will use. Last year, we actually moved into a new warehouse, a larger warehouse, which we doubled our storage, our cold storage capacity. We also co-located with two other nonprofits, Asian Pacific Island Forward Movement and Polo's Pantry, as well as a for-profit farm, Sunrise Organic Farm. This has really created a unique and collaborative space for us. And through that growth, we've been able to support Hollywood Food Coalition has been able to support 240 partners and rescue about 3.2 million pounds of food. We were also able to scale really quickly with the fires and partner with local organizations in and around Altadena, again, because of the larger capacity that we have. You know, as I start thinking about this topic and thinking about some of the challenges that Lena touched upon, thinking about the cost of living, especially around food and all of that rising here in LA, it's clear that no single organization can meet the need alone. That's where the collaboration is going to become critical. Through our efforts on the LA Food Recovery Alliance, we're able to really coordinate, share resources, align, reducing waste and increasing equity. And that's the kind of, I think, collective approach that's going to be necessary to strengthen the whole system. So again, it won't be, ultimately, it won't be, if we want this equitable food system that truly works, it won't be built by one organization. It's going to be our collective approach and our commitment to show up for one another because we believe that everyone deserves really good food. So I'll end with that for now.
Thank you very much. So within the food and nutrition pillar of the Good Food for All agenda, we have an entire subpillar around community-driven food security. SJLI is one of the many shining examples of that type of work in action. So Nicole, can you share some of the community projects and programs at SJLI that you're most excited about? and how you approach ensuring the community is driving the work.
Yes, definitely. Our community has driven our work from the get-go. Every program that we've ever done has come out of a response to what our community has said that they've needed. And we let them drive not only the solutions themselves, but how those solutions roll out. And so we plan to continue that. We do that through things like community-centered design, having forums, creating space for folks to share their stories while they are coming to receive our services. Our workshops always turn into like a little town hall where folks can speak up, can ask questions, can share knowledge and information. And so we plan to continue that. Right now, our community is responding really well to our food rescue and distribution, which we've worked on with a lot of partners right here in this space. And we're really proud to be able to say we've donated over 5 million pounds of fresh fruits and vegetables. We really had to step up in the pandemic. We started doing a food hub every single week. We have not missed a week since March. And so we're serving not only our individual community members, but also other organizations. We'll fill up your truck, we'll fill up your back seat with food that you can take back and serve your folks with. And not only are our community members receiving that food, but they are our volunteers. These same people that are receiving our services are coming and helping to feed their neighbors. And that's exactly what we want to see as we talk about, empowering our folks to do this community work. We are also really in our urban agriculture bag right now. It's really an honor to be partnering with different organizations like Partnership for Growth LA as we grow food, not only to donate to our neighbors, but also creating, economic prospects through this by selling that food to local food vendors, making sure it's high quality food, organic food, and that the folks that we're selling the food to are running their businesses in ways that would be in accordance with the Good Food for All agenda. So we're really proud of that. Also teaching our community members how to grow food. We recognize that the food system we have is just not sustainable. But if everyone is empowered to be able to grow food and network with each other around the food that they're growing, that's important. So creating the Inglewood Growing Network is happening at the moment in partnership with like the Inglewood Public Library. We have a seed library there. There's lots of things happening that's really engaging our community. And then the thing that I'm really, really excited about is SGLI right now is building affordable housing, right? We talked about all of these different things that contribute to the health and wellness of individuals and community. And we know that housing is an issue. And so how can we help folks get some ground under their feet, literally and figuratively, that allows them to have space with their money, stability with their money. So yeah, 120 units of completely affordable housing, along with a mini farm, a community kitchen, community gathering space, just all these places and things that will allow folks to thrive, build community with each other, and stay involved with us if they want to, so that we can continue moving forward. So yeah, I'm very excited about what's happening in the future, despite, these challenges that are here allow us to work with our community to find solutions. And so that's what we do.
Thank you. And I can see you just light up when you're talking about that. So I can tell the passion is there, and it's just so amazing to hear what you all are working on. Just a quick reminder to folks, we have a couple more kind of facilitated questions, and then we will have plenty of time to take questions from anyone who is here joining us. So if there are things that you are wondering about or wanting to know more, please feel free to add those to the chat. So Arnali, I'll return to you. Similarly, one of the agenda items is related to wraparound services. One of the items is specifically talking about increasing wraparound services and partnerships. So can you speak to the work that HOFOCO does in this regard and what you're excited about in terms of scaling?
Thank you so much. That's a great question. And it's great to follow what Nicole was saying around, building and partnerships. I think for us, especially having a meal service for so long, it just felt very natural for us to try to co-locate other services on site. I think food is a great entryway. It's not like the end point. It's certainly a way to build these relationships and leverage those relationships for more. And I think for us, it was really critical because we're open 7 nights a week, when everything else is closed. we felt like, how do we continue to help folks rather than turning people away? They were often coming to us because we're consistent for things outside of food. And, rather than us expanding our services or our expertise, we're like, how can we partner with some of our local providers? And so that's in fact what we've been doing is, we have UCLA Mobile Connect that comes every Wednesday. We've been partnering for decades. They provide medical care, physical therapy, optometry services, a smattering of other services. We also have housing navigation, case management, mental health services. So we have lots of things. We're also bringing on sort of recreational activities, like sewing and woodworking and things like that, to provide, different types of care and needs that people have. I think while also doing that, it allows people to share things that are really critical for them to get plugged into services. Because oftentimes there's so many challenges that our community is facing and transportation and getting to places. And so the more that we can co-locate and provide those types of spaces, I think it opens up doors. I think as we start scaling, I know we at Hollywood Food Coalition are thinking a lot about how we scale. And when I think about scaling and expansion, we don't think just how do we grow? It's like, how do we do it with intentionality? How do we deepen partnerships? How do we find the right partners to work with? Because again, it's listening to the people that we serve and saying how, what is it that you need? How do we be better partners and really developing these services with them? So I think we're at a really interesting point at like thinking about, how we might expand. There's so many things that are changing daily, hourly, sometimes in the external landscape. And I think we have to really work together collaboratively to come up with solutions. So, Nicole, I share excitement. We have some really big projects that we're thinking about, but we're also, like you all, really thinking and intentionally around that. And Lena, it's just been great to hear the broader context because that all has to come into play. And, the providers can all play a role of educating our community so that they understand that the landscape is shifting. So I think that's all I'll say for now, Anna Alicia.
Thank you very much. And so, Lena, I'll turn to you for our final moderated question. But again, we'll still have plenty of time from the audience. So we want to close out the panel acknowledging that access and eligibility to SNAP and CalFresh is changing. And the two-pronged approach we're collectively taking is to ensure that folks are fed and taken care of today and tomorrow. So systems change is ongoing, and it's going to be shaping our future. AB 229 at the state level, known as the CARET Act, would establish a state-funded food benefits program for people who are losing eligibility to federally funded SNAP benefits due to changes as a result of HR 1. So can you speak broadly about what is or can be done on a systems level to address the food and nutrition security that will rise as a result?
Yes. Okay. So first, to just level set again, to reiterate what Ana Alicia said, we're entering a very, very dark time in terms of access to our safety net. The changes to SNAP are mirrored in changes to Medi-Cal, which are duly like incredibly important programs. Food is medicine, and people need health care, and they're so interconnected. And the same populations that are likely to lose CalFresh because of work requirements will also be at risk or likely to lose Medi-Cal at the same time. So I just wanted to drop a really quick resource in the chat that explains who is losing CalFresh benefits. It's an estimated 20 to 30,000 people losing due to changes in immigrant eligibility. These are some of the most vulnerable immigrants. They're considered what we sometimes collectively call like humanitarian immigrants, survivors of war or other hardship, who are refugees, who are asylees, who are trafficking survivors. Their benefits will just go away on a rolling basis between April 1st and their next redetermination within the year. So that creates a gap of those folks. Then we have work requirements starting June 1st on a rolling basis, and for all new applicants, 840,000 Californians will be subject to these expanded work requirements, which no longer exempt people who are unhoused, people who are veterans, TAY youth, our most vulnerable people with the highest barriers to work, and there's no additional funding or support to find work. And so we're, like Annalicia said, we're anticipating 200 to 300,000 people currently on SNAP because they need it to eat, to feed themselves and their families, losing SNAP. And then at the same time, there are overlapping threats specifically to immigrants. Pending changes to the public charge rule, which may take into consideration any public benefit dramatically impacting immigrant access to the safety net. 34% of our county are people who are immigrants. Half of all children live in an immigrant household. So this doesn't just have an impact on those immigrants, but a ripple effect on their feelings of safety and accessing these benefits for their citizen children. There's repeated attempts to access data from public benefit applications for the purpose of immigration enforcement. And as we all know, just a general environment of aggression and fear. So what can be done? That's supposed to be the bright spot, and that's why we're coming together, and we so appreciate you bringing us together. So what I keep saying is we just have to radically coordinate around all of these systems. That includes health systems, our food system, our nonprofit system, because what we know about the populations specifically subject to work requirements is they're likely to lose benefits. These work requirements are not new, they're just kind of new in LA. There's great Urban Institute studies that show people are going to lose benefits. When are they going to lose them? The month that they use up their 3 months, and then they don't come back. So there are exemptions for medically frail people. It's called medical frailty in Medi-Cal. It's on fitness in CalFresh, which is kind of a weird word, but it doesn't mean you're permanently disabled. It just means you have barriers to work. That's where our health systems come in. But people also need to know their rights to claim exemptions. That's where all of us come in. When they walk into any food service or any of our nonprofits, we should be working together to screen, because these are federal dollars. SNAP and Medi-Cal, they're federal dollars, and people's loss of benefits falls on our local nonprofit systems, charitable systems, and county systems. So we have to all work together to keep our federal funding, and we have to educate ourselves. Then there will be people that fall off, so we have to fill in these gaps in our food systems. But I don't have to tell Arnali and Nicole that there already is more need than supply, even in our current environment, before these changes have the dramatic effects that we'll be seeing in a few months. So there just has to be some kind of major system rethinking and coordination there. And then ultimately, while I can't comment politically because we receive federal funding for our legal services, obviously these are all political choices that have been made, and the only real solution is political and policy. And that's where some of these other organizations come in and are doing that work. SNAP is proven to work. It lifts 3 million people out of poverty a year. So it's not about it being a bad system. It's about political choices. It bolsters the economy. Every dollar put in leads to $1.5 to $1.8 in economic activity. So how do we get back to a place where we really support and cherish SNAP?
Thank you all. Really appreciated all of your comments and your insight. And Deja, I will turn it back to you.
Yeah. And thank you so much. This is such a good conversation to hear from all of you, and to kind of see the pieces of the puzzle fitting together, and knowing that, like, Arnali, you say you work with 200 folks, and Nicole, you work with 200 folks, and Lena, and so, like, obviously there are 3 folks in the room, but they're, like, also speaking to and on behalf of, like, their other partners to really show this work. If there are any specific questions, I know we've been answering questions in the chat as they've come up, but if there are any other questions that folks would like to share in the chat, you can raise your hand and we can bring you off mute, or you can put it in the chat and Tonya will grab the question and say it, or we'll pull you off mute. I also want to flag there at the county level, to the point that folks have shared, there is opportunity to, like Lena was saying, like how do we fill some of the gaps left by the federal dollars leaving ultimately will have to be filled either through county dollars or nonprofits, et cetera. And so there is work being done at the county level. And so while the window for this, there's not like a ton at this exact moment, you can still sign on to the action alert to tell LA County to prioritize immigrant food justice in their upcoming budget. And that is something that if you follow LAFPC or really any one of our orgs, as more action alerts and items come up as we move into like budget and ledge season, you'll get those alerts through our newsletters or on Instagram or whatever social media there may be. So certainly follow us there. I see one question. And this might be a good one for you, Annalicia. Like, are there opportunities to support with advocacy efforts around AB 2299? So an extra 9, but yes.
I just dropped a link in the chat. I was doing a quick search. So yes, AB 2299 will be heard in Assembly Human Services Committee on April 14th at 1:30. California Association of Food Banks is currently rallying folks to provide a Me Too. So if you're able to join, they have some information there about how you can provide comment. And if you're in the Sacramento area, you can provide a live comment during the meeting.
And then if that's something that's of interest to follow up on, you can always reach out to us and we can make sure you're connected if you are not already connected. And then I'm losing track of the chat. So if you want to uplift one if I'm missing something.
So Natasha put, Arnali, could you talk about more how you incorporate cultural relevancy in your meal services and what types of responses do you see from those who partake in those services?
Yeah, I would love to. And thanks for asking that question, Natasha. We obviously see people from all walks of life, and we talk to our folks really regularly. So we will often get requests from our guests. And what's been great is we've been able to bring in different chefs from different backgrounds to work with our chef. So we've really been able to take, just source different types of food and make these meals. Like we just had a Passover dinner where we made a matzo ball soup that was super delicious. When we had Lunar New Year, we were able to make dumplings. So like there was so many cool and fun things that we were able to do. And that's really, I think, being respectful to the people that we serve by incorporating that in, but like also our volunteers and our staff have such joy in making the food. So it's really a lovely way to show people respect and have dignity by making this type of food and presenting it. I mean, I know for me, like I'm Indian and grew up on white rice and I always have a preference for that. And so it just feels very respectful and dignified. So anyways, if anyone knows of any chefs that want to come and cook with our professional chef, we love to make delicious food and serve people and take care of people. Please reach out to me.
Exactly. So if you know any chefs, let her know. I'm sure there's a bunch of other folks who would also accept it. Except for extra hands and extra help. Keisha, let me I have to click it so you can actually talk. You should be able to. Oh wait, sorry.
Good morning. My name is Keisha Mills, and I'm the owner of Winter Grey Sugar-Free Chocolates. We sell sugar-free, gluten-free, and nut-free chocolates for people that have diabetes, celiac disease, and tree nut allergies. We also have a concentration towards children that have autism, ADHD, and cancer. We know that none of these people can have sugar. Sugar is like their enemies to their diseases. We sell chocolates for people that have chronic and medical conditions. We sweeten our chocolates with 100% organic monk fruit that does not cause a spike in your blood sugar levels, neither does it have an aftertaste. So I have positioned my chocolate to be almost a medical solution. So I pitched Cedars-Sinai Hospital on November 6th and got accepted to sell not only in Cedars-Sinai hospitals, but in all of their affiliate hospitals. Also, I would like to put the chocolates in the VA hospital and Children's Hospital in the gift shops. So I also would like to have people that have a medical and chronic diagnosis to be able to use their medical insurance to purchase the chocolate. And I would also like to receive EBT. So people that have EBT that have a medical and chronic condition to receive the chocolate, to use the EBT to purchase the chocolate. So I am definitely in the right place at the right time. And I don't know if I should stand on my head until my ears turn red because I've been trying to find out how can I go about in pitching the Los Angeles LA Care to see if I can get my chocolates to be certified or accepted so people can use their medical insurance for the to purchase chocolates. So if anybody out there can help me, please help me.
Well, first off, congrats. I won't say I'm necessarily the best person to answer the question, but I love to hear it, and congrats on the placement with Cedars and their affiliates. I have some thoughts that are more broad, but if any of our panelists or even anyone on the call maybe have like maybe a more specific answer, and then I can kind of, if not, I can soup it with like a broader answer. Yeah. Nutritionist, and pregnancy. Beautiful. Okay, I see some folks in the chat. I'll say, and this is one of the agenda items, is how do we support our retailers, more retailers in getting CalFresh and WIC certified so they can accept that. So I think but that is typically for like a brick and mortar location. So unless you already have a brick and mortar location, I think it might be a little tricky just because they haven't caught up necessarily fully to the times of like the mobile options and things. A lot of those are very new. So I would actually potentially say, like, I know Children's Hospital actually has like a particular shop that is planning to accept CalFresh. And any other retailers that already accept CalFresh, folks can then go to that retailer and use it to accept to purchase your chocolate. And then particularly when thinking about some of the food as medicine and the medically tailored pieces, there might be some partners who are like focused in that area who might have a better sense of like how you necessarily get on those supply chain lists, essentially, so that the folks putting together the medically tailored boxes have you listed as a supplier for things like for the chocolate in particular. So that could be something that we could follow up on too. And it looks like there are some folks in the chat who may be able to follow up too. All right, cool. Congratulations. Yeah, and I see lots of folks offering help and connections. And I do think this point around like how do we ensure that those folks who are doing the work are then connected. So and if you find an answer that is that is specific and can be applied and replicable, let us know so we can tell everybody else too. Antonia, are there any? Okay, so there was a broad question that someone chatted to Tonya, right? Just in general, of how can folks get involved for each of your orgs? If you all maybe, we've dropped the links to like your websites where folks can sign up for newsletters, but if there's anything in particular actively that you would like to uplift around how folks can get involved and support.
We have a food distribution on Saturday at Augustus Hawkins High School. So if you're looking for something to do, come and volunteer with us. We'd love to have you.
Beautiful. And then again, you have the links to all of these, all of the orgs that we dropped in the chat. If you registered, you'll get like that follow-up email after the fact for things. To kind of close us out, I'll just launch one last poll that should pop up on folks' screens. just around like where are you doing your aligned work? I mentioned those 6 different thematic areas for this pillar. And just curious, where are folks doing aligned work already? And then the second question is around temperature checks of collaboration. Are you like, this is 100% your game and you're ready to collaborate and coordinate? Or maybe you're just interested and curious and you're not necessarily in a place to collaborate. And that's also very okay too. Depending on where you are at an org and who you're serving, it might not make the most sense to collaborate on this particular issue today, but you want to keep aware of everything that's happening. So that's kind of the poll to get the temperature check as we continue this work. And again, this is the beginning. The Good Food for All agenda expands out over 10 years. So with a more dedicated kind of check-in point at the 5-year mark, and then again, obviously at the 10-year mark. So we will continue to have more of these opportunities and sessions moving forward. Like I said, if you are familiar with LAFPC, Arnali mentioned our LA Food Recovery Alliance. You certainly can join us there, where we, as an alliance of food recovery orgs, coordinating capacity building. Nicole is actually the co-chair of our Good Food Economy Working Group, which is focused on thinking about how we support retailers, workers, and supply chain actors in reshaping our local food economy. And then, of course, the amazing work of Viola Network and Lena doing around some of this immigrant food justice, and in particular just benefits access as a whole. So if your org is doing work with folks, as particularly any number of folks that we mentioned are going to be impacted by changes in SNAP or even just cost of living challenges, for sure reach out to us and we can connect you to Viola or any of the other orgs just to have some community education around like some of the changes so that folks can at least be prepared and then tap into their resources as well. So thank you so much for being with us here today. Have a lovely rest of your week, and we look forward to continue the interaction. We'll be back next Wednesday to do the same thing, but on environmental sustainability, and you'll hear from LA Compost, UCANR, a local farmer, and LAUSD. Thank you. Bye, everyone.